Hi, it's Dr. David Greene, founder and CEO of R3 Stem Cell, the global leader in regenerative therapies. I'm continuing on today with our FAQ video series. I'm up to number 44. Is intrathecal stem cell therapy safe? Intrathecal refers to an injection into the spinal cord through the lower part of the back. And I refer to it as a reverse spinal tap because most people know what a spinal tap is. So if you're getting a little spinal fluid taken off for a diagnostic purpose, that's how they do it. Anesthesiologists will remove a little bit of cerebrospinal fluid from the lower lumbar area. In this case, it's the same approach with the same spinal needle and whatnot, but fluid isn't taken off. We're putting the stem cells into the spinal cord. So yes, it is very safe. There was a recent meta-analysis that came out this year. So what researchers will do in a meta-analysis is they'll pull a lot of research studies and pool the results statistically together. And what they found with intrathecal application of stem cells is that it was very, very safe. There were 0 significant adverse events. There was maybe a little bit of temporary nausea, temporary dizziness and lightheadedness, but none of that persisted and patients did fantastic. We've been doing intrathecal stem cell therapy at our centers for the past decade, and we've done over 1,000 cases of intrathecal application of stem cells in both adults and children, such as with autism spectrum disorder or cerebral palsy. Now, the intrathecal procedure is very short. It's about 10 or 15 minutes. Our anesthesiologists are very highly skilled, and when they put the spinal needle in, they'll use local sedation. So for the adults, it's very, very well tolerated. For children, we use conscious sedation. So the children aren't put to sleep, they're basically just sedated, and a lot of them fall asleep, but it's not general anesthesia. All right. Now, the procedure itself involves a spinal needle, like I mentioned. The anesthesiologists who do this all the time reach the spinal cord. They'll then check to make sure a little bit of the spinal fluid is coming out like a drop, and then they'll put the stem cells in. We put up to 50 million stem cells at one time. It's been extremely well tolerated with some temporary side effects. As I mentioned, maybe a little bit of nausea, maybe a touch of vomiting. That's unusual. Possibly a low-grade fever or lightheadedness, dizziness. Those things, all of these things are very temporary. Usually they last about an hour. Some will last overnight though, all right? But it's been very safe, so there you go. Visit us online today at r3stemcell.com. Then call us today to get your free consultation at +1 844 GET STEM to see if you or a loved one is a candidate to receive one of these groundbreaking regenerative procedures at any one of our 70 centers in 7 countries. All right, thanks for watching.